And we welcome back to this segment Dr. David Samadi, Chairman of Urology and Chief of Robotic Surgery at Lenox Hill Hospital. Hello, Doc. How are you?
Steve, how are you?
Good. Great to talk to you. And we have a lot of topics to get to. So let's start. First of all, the story on these. I guess antibiotic-resistant superbugs, as they're being referred to. They've been around for a while, and every so often, the story comes to the top of the pile, so to speak. But it seems as though they're really becoming a bigger and bigger concern in the medical community.
Yes, this is a kind of discussion. In fact, this week in the urology discussion that we had at the hospital, this is becoming more and more serious because we're seeing bugs such as E. coli, Salmonella. These bugs are becoming resistant, and part of it is because of the overuse of antibiotics. Unfortunately, over the years, as a result of use of antibiotics, we have wiped out all the good bacteria. All the bad bacteria also are gone, but they have gotten to become resistant. They go through some gene mutations and they multiply, and we are losing this war. And then we've seen over the years Staph aureus and SARS and many other kind of bacteria have become more and more power. And now we have these superbugs that we're talking about here. We're talking about C. difficile, we're talking about gonorrhea, and we're talking about this CRE, carbapenem resistant enterobacterius, which is really deadly. And a lot of it comes from hospitals, and we're having a difficult time. Meanwhile, Steve, another huge issue that we have is that the companies over the last decade have not gone out there to really come up with new antibiotics. As you know, it takes about $1 billion to come up with a new antibiotics and years of investment. So most companies don't think this is really worthwhile, so we're falling behind in this war against these bugs.
And all we could do as patients or civilians, if you will, is, when we're in a hospital setting, certainly wash our hands and use, the germ, repellent, whatever it's called, sanitizer. But there's really nothing else, that we could do. Like, for God forbid, if we get E. coli and we go to a hospital and they give us give us a drug and it doesn't work, I mean, we're powerless, right?
Yes, unfortunately, we see these infections in the ventilators in the hospital. We see the blood-borne in the blood system, and also we see it in urinary tract infections and patients that have, chronic catheter use. So you're right. If your doctor comes in and they start shaking your hand, it's not awkward to say, "Doc, do you mind washing your hands?" And they have these hand sanitizers all over the hospitals, but both healthcare providers and patients, they need to be aware of this. And we also need to cut down on all these antibiotics. You get a little cold, you go to the doctor, they give you the Z-Pack. Ask them, do I really need this? Are we treating bacteria or is it a viral? So 50% of the antibiotics that we're using in this country is overused, and you don't need it. So that's why we need to be careful.
Well, it's funny because I'm battling a little something for a week. I went to my great doctor today, and he said it could be a sinus infection, but I think it's viral. So he did not give me an antibiotic, and he suggested an alternative. So it's funny you say that. Very coincidental. Okay, it's also Prostate Awareness Month. And we have a couple of minutes left, 3 minutes left. Men are getting mixed messages, as you and I have talked about, from the government. I don't think it's a coincidence with the Affordable Care Act. Don't get a PSA. Don't get a digital exam, which is where the doctor actually feels the prostate. Wait till you're 50 or 60 or don't ever get it. But obviously, you and I think, are on the same page. Get it.
Yes, absolutely. In this week's Sunday House Call on Fox News, we talk about the fact that for mammograms, instead of 50-year-old, they should go to 40, because now they're finding out all the recommendations from a few years ago for not to go for mammogram was a big mistake, and they're finding out young women with breast cancer, which are really aggressive. I can tell you the same exact thing is going on with prostate cancer. PSA should be checked at the age of 40 as a baseline. And we see a lot of younger men that are coming with aggressive tumors and disease. People need to go out there and get tested. Obviously, my work is all these robotic surgeries that we do at Lenox Hill Hospital, and that's the first line of treatment because you get the cancer out. And I always think that radiation should be the second line of treatment, because if surgery fails, you can always give radiation. If we do radiation, it would be very difficult to do surgery after radiation. So a word of caution to a lot of people. There's like so many ads about these cyber knives. Almost every 2 minutes there's an ad in the radio about these new cyber knives. We don't have a long data and long-term study with this. So you have to be really careful. But get the PSA tested, find out what kind of prostate cancer you have, and always get a second opinion to make sure you're getting the best care.
All right, one more. We got about a minute left. This new Obamacare thing, I read where doctors are going to be required, every doctor is going to be required at least once to ask you, are you sexually active, how many partners, and are you gay or straight, basically?
Yeah. It's unfortunate because, it's coming from the government, and you can call it Obamacare, then comes to the head of the hospitals, and in the previous hospital that I was, tremendous amount of pressure to go with all these electronic medical records. And the doctors are going to become some agents to get the patients on their privacy from their patients, goes into these electronic medical records, and the rest, your bet is as good as mine. All this information may be shared with a lot of other people. So my advice is that, that's a private information that if you want to share it, it's perfectly fine. If not, you can say, I don't mind, I don't like to share that with your doctor. So doctors are going to be used, unfortunately, as an agent to get a lot of information that may or may not be necessary.
Doctor, always a pleasure, sir. Thank you very much.
Good to see you. Have a great week.
You too. Take care. Dr. Samadi, David Samadi, Chairman, Urology and Chief of Robotic Surgery at Lenox Hill Hospital, here on the Steve Malzberg Show. When we come back, this is the first interview. Very important book, very controversial book. Author Stephen Jimenez joins us to discuss the Book of Matt, Hidden Truths about the murder of Matthew Shepard. Matthew Shepard, an iconic figure because of his tragic murder back in the late 90s for the LGBT movement. We'll talk about it right here on the Steve Malzberg Show. Don't go away.
The Steve Malzberg Show.